Good afternoon, ma'am. I am Nicalo Franco Duaves, BS Cream 1 Section Foxtrot. Today I will discuss the natural and artificial methods of contraception. First, I tackled what is artificial methods. Artificial methods can be defined as any product, procedure, or practice that uses artificial or unnatural means to prevent pregnancy. One of it is oral contraceptives, or also called as birth control pills, and are a safe and reliable option for preventing unwanted pregnancy. Oral contraceptives are usually prescribed for 4 weeks at a time, with each 4 weeks packet containing 4 to 7 days of hormone-free pills. Advantage of oral contraceptive pills. It does not interrupt sex. It usually makes your bleeds regular, lighter, and less painful. It reduces your risk of cancer of the ovaries, womb, and colon. It can reduce symptoms of PMS or premenstrual syndrome. Disadvantage of oral contraceptive pills. The most adverse effect of combined oral contraceptive pills is breakthrough bleeding. Women will also complain about nausea, headaches, abdominal cramping, breast tenderness, and increased vaginal discharge or decreased libido. Side effects of oral contraceptives. Side effects of oral contraceptives vary depending on the pill's hormone level and types. Some include vaginal spotting and abnormal bleeding, breast tenderness, bloating, and nausea. Can is transdermal patch. Advantage and disadvantage of transdermal patch. The hormones from the patch aren't absorbed by the stomach, so it still works if you're sick, vomit. It can make your periods more regular, lighter, and less painful. It can help with menstrual symptoms. It may reduce the risk of ovarian womb and bowel. Side effects of transdermal patch: an increased risk of blood clotting products, heart attack, stroke, liver cancer, gallbladder disease, and high blood pressure. Breakthrough bleeding or spotting, skin irritation. Third is vaginal ring. What is vaginal ring? Vaginal rings are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administration over extended periods of time. The ring is inserted into the vagina and provides contraception protection. Vaginal rings comes in the size that fits most women. How to use it? Squeeze the ring and insert it into your vagina, like inserting a tampon. It stays in your vagina for 3 weeks. You then take out and throw it away and wait 7 days before inserting a new ring. Advantage of vaginal ring. The ring may ease premenstrual symptoms, and bleeding will probably be lighter and less painful. Disadvantage of vaginal ring. You may not feel comfortable inserting or removing it from your vagina. You can have spotting and bleeding in the first few months. Side effect of vaginal ring. Side effect might be temporary, such as increased vaginal discharge, headaches, nausea, breast tenderness, and mood change. Hormonal injection. What is hormonal injection? The hormonal injection prevents pregnancy by injecting a synthetic version of the hormone progesterone, called depot. Medroprogesterone acetate or DMPE. The injection is also called depot. Depot prevents the body from producing its own hormones and release eggs from the ovaries. How to use it? A doctor or nurse will inject depot into muscles, tissue in your arm or bottom. For continued contraceptive protection, this should be repeated every 12 to 14 weeks. is chemical barriers? Chemical barriers or spermicides are sperm-killing substances available as foams, creams, gels, firms, or suppositories, which are often used in female contraceptions in conjunction with mechanical barriers and other devices. Spermicides are usually available without a first prescription or medical examination. Advantage and disadvantage of chemical barriers. It is available and affordable. It can prevent the spread of STDs with used properly. Effective as a contraceptive is compromised when the barrier is damaged or not used properly. Types: male condom, female condom, diaphragm. Male condoms. What is male condoms? It is a thin tube that fits over the penis. Condoms can be made of rubber, latex, plastic, or lambskin. They prevent sperm from getting into the vagina. Rubber and plastic condoms also protect against STIs. Lambskin condoms do not protect against STIs. Method is natural method. What is natural method? Natural method is a method of preventing pregnancy without the use of medications or physical devices. These concepts are based on awareness and observation about a woman's body and menstrual cycle. First type of natural method. What is abstinence? Sexual abstinence or sexual restraint is the practice of retaining from some or all aspect of sexual activity. Second is calendar method. What is calendar method? Calendar-based method are various methods of estimating a woman's likelihood of fertility based on a record of the length of previous menstrual cycles. Various methods are known as the Canus-Ogano method and the Retham method. How do we use the calendar method? Before you can use the calendar method as birth control, you need to keep in track of the length of your menstrual cycle for at least 6 periods. You can do it with a regular calendar or with a period tracking app. There is no physical side effects of using calendar method, and you can even also use it to plan on pregnancy. Next is basal body temperature.